Hi, I'm Dr. Dennis Hartlieb with Dental Online Training with another clinical tip and product review for the restorative dentist. Today, I'm here to talk to you about injectable composites. This is a great technique if you want to simplify doing composite veneers in your practice. Today, we're going to be using the industry leader for injectable composites. This is from GC, the G-ænial Universal Injectable. With this material, we're also going to be using a clear PVS material. This was made from Exoclear, also from GC. If you're interested in this material, check out one of our other YouTube videos where we went through how to make these PVS matrices using Exoclear. Also, with this technique, if you want to learn how to do this technique in detail, check us out at dentalonlinetraining.com or dothandson.com, where Dr. Ryan Springer has done a course for us showing this technique in detail. All right, now let's get in. Let's take a look at this product. I'm going to place on my loop so I can see a little better. Now, in the kit with the syringe, you're going to see two different tips. There's going to be a long tip. We'll use the long tip for the anteriors, where we want to make sure that we can get the tip all the way down to the cervical, and then we'll pull it up. You'll see how we do that. The black tip is shorter. We would use that for posterior composites if we're going to be using an injectable technique to, say, do a posterior buildup. Now you'll see there's a third tip here, and this is sort of straightened out. I'm going to show you why we have that. With our PVS guide, we need to create a little port for us to be able to inject the composite through. Now it's critical when you create these ports that you create the port coming from the inside and working out. The reason we do this is that if you do it opposite, if you go outside in, sometimes the material will create a little hanging portion. That little hanging portion of the PVS material could get trapped into your composite restoration, which you can understand would not be ideal. Now, secondly, we want to use a different tip than the one we're going to use to inject, because some of that PVS clear material could get inside that tip. And obviously we would not want to inject that into our restoration because that also would not be ideal. So I'm going to use one tip to create my little port, set that aside, and then I'll have my second tip that I'm going to be using now that will be coming from the outside. And coming in through our matrix. We've already prepared our tooth for the veneer, and we've placed PTFE tape to protect the adjacent teeth and keep the flowable composite from going onto those teeth. We're going to try on our clear matrix here. And you'll see how nice and clear this is. It really is very helpful when you're doing injection molding so that you can see the material flow. Also, obviously, the clearer the material is, the better it is for light curing the composite. We're going to place our tip onto the G-ænial Universal Injectable. And before we go ahead and inject onto the tooth, I'm going to remove my Exoclear PVS guide. I'm going to begin in the flow of the material. You can see how easily it flows. I'll take a gauze. And here's a tip. We're going to go ahead and line the incisal of our PVS guide to help prevent any little bubbles that could form or any voids that could happen as we're injecting where air could get stuck. The other thing that we can do to help ensure adaptation of the universal injectable is place a thin layer over the tooth that we're going to be veneering. This just minimizes the risk of any voids or any non-adaptated areas from the injectable onto the tooth. All right, now we're going to gently place our Exoclear guide into position. Then we're going to take our tip through the port. And you can see we're going to go all the way down. Now I want to keep light pressure on the cervical as I'm injecting, and I'm going to watch the material flow. And as it's flowing, I'm going to very slowly be lifting up the syringe, but keep on injecting. I can move the tip to the sides. Keep on injecting, making sure that we're eliminating any voids, looking for any air bubbles. Slowly, as we're continue to inject, we're going to be removing the tip as we continue to inject out the surface. And you'll see that there's going to be some excess that runs off. That's great. That's a great sign. I can use the side of the tip or an instrument to wipe that off. Not that that's important. The key though is I'm continuing to hold with sort of firm, moderate firm pressure along the cervical to keep excess from running out the cervical. With that in place, now I'm going to go ahead and light cure. I'm going to do a final cure on this. So with this material, with this light, I'll cure for about 40 seconds to be certain that the composite is completely cured. Depending on your light source and the PVS material that you've used for your guide, the clarity of that material, you may want to alter the amount of light and the time that you're using for your curing. So I would recommend you cure 40 to 60 seconds to make sure that the composite, the injectable composite, is adequately cured. Now that it's cured, I'm going to lift off my Exoclear PVS guide. And you can see that I have a really nice representation and detail of the tooth from the PVS material. Now this is so important to use a high quality PVS clear material because you want to get nice representation of the tooth that you're trying to create. From this point I would use either a blade or a burr to go in and start to remove the excess. But you can see from just the injection how nice that looks. Okay, so after I've done my contouring and polishing, you can see the restoration has a really nice gloss to it. The material is really nice. These injectable composites, they have the same flexural strength as what we get from our traditional composites. I don't understand the chemistry, but they're very durable. They're a really nice restoration. There is more cleanup involved when you get into doing injectable versus a hand-formed or freehand composite. But you can see how much time it saves, and if you have a nice wax up, you're going to get really a nice result like what you see here. If you have any questions about polishing composites, check out one of our other YouTube videos or check us out at dentalonlinetraining.com or dothandson.com. All in all, it's just a lovely product, very nice. It's easy to work with. You can see it has a really nice polish. It's a great material, so check it out. If you're interested in doing injectable composites, this is certainly one that you should be considering. Well, that's it for now. Look forward to seeing you when we do other clinical tips and product reviews in the future. So until next time, yours for better dentistry, I'm Dr. Dennis Hartlieb.